So what increases susceptibility to infections for people experiencing homelessness?
When I ask the homeless folks that question, or people who work with them, the first thing that they come up with is overcrowding and proximity to other people. When people come to a shelter, they're sharing the overnight air with maybe 50 to 100 people. Most of us don't share the air with that many people as we're sleeping. And stress is probably the second thing that comes up for people, that they're under constant amount of stress.
We have to pay attention to stress management. We have to solve our problems because we have it a lot tougher than anybody else. I never understood how difficult stress could be on the human body. I mean, I hurt all the time.
Along with that, sleep deprivation, poor nutrition, lack of health care, or they have other conditions that keep them from getting to a doctor. They may have mental illness or an addiction that's kind of taken over, or they have other reasons why they don't want to see a doctor. Homeless people sort of reflect the entire population, so we have people who are homeless that come from all age groups, and then there's different ethnic backgrounds. There are gender groups, there's special shelters just for women and just for men, and very few for couples, unfortunately. People with families, including babies and young children. There are teenagers who may be unaccompanied by adults or family. There are elderly people who carry with them also more chronic diseases that put them at risk for communicable diseases. So we have to consider these different population groups as well.
It is important for families to keep up to date with immunizations, get a flu shot, provide a clean environment for children to play, and, as always, encourage frequent hand washing.
Kids are exposed to other kids with illness. What do you do when you're dealing with families who might be ill? Trying to help find care for the kid could be one issue.
If one of my kids gets sick, it just sends a big old chaos. It's very hard being a single parent, but you do what you can.
It's challenging for families because of the fact that they live in such close proximity to each other. The more common communicable diseases that we see here are upper respiratory infections, influenza, conjunctivitis, gastroenteritis, MRSA, scabies, some lice. It's often very basic things that can help. We can't emphasize enough how important it is to do hand washing, especially before they eat, after they use the bathroom. We get the moms to work with the children, so it's a kind of a fun thing to wash your hands. Maybe we get them to sing a song while they're washing their hands. They all love to use hand sanitizers because of the nice fragrance. Keeping the home environment clean and sanitary is really important. We encourage moms to put blankets and sheets on the floor, and so the kids can play freely on the blanket, so it creates a kind of a nice, clean environment.
Teenagers have strong immune systems, but risky behaviors and close proximity to each other during illness can increase the risk of passing communicable diseases.
Teens who are homeless are no different than teens who are not. They tend to not really think before they act. They may share things that other folks wouldn't necessarily share. Because safety is such an issue, they'll often stay in groups. And so if one person in that group gets sick, then pretty much they're all going to be sick.
Youth also are wonderful educators of each other, so if you have people who have an understanding, they can be a great peer educator to other youth.
Someone would say, "Can I use your makeup?" And I'd say, "No." And it wasn't because I was being mean, but it was just because I had my own germs too. So a lot of times, instead of letting it seem like they had the germs, I would say, "Well, you don't know, where my eyeliner's been, so don't even ask."
People who are sexually active, or people sometimes are coerced into situations where they're maybe using sex for survival and are at risk for sexually transmitted diseases to survive, to get by, to have food and shelter. I think those are areas where youth are particularly vulnerable.
My name is Jeff Clemens, and I'm a nurse. The REACH project works with people that are homeless and addicted to alcohol or drugs. So we're going to go visit two people that I set up to give them their hepatitis A and B shots. Good thoughts. All right. Well, I do a lot of wound care. That's what I'm trained in is wound care. The nice thing about it is it's a really an immediate kind of thing that you can do for people and really help them. Because a lot of people with their addictions, they're not going to go into the clinic. And that has been really very successful. We've outreached a lot of people and got people into housing and primary care, that kind of stuff. You know, maybe if you wanted to go into treatment too, he could.
That might be a good idea.
He could set you up
because,
for
you know
that. So I routinely give people vitamins just because they're not eating very well. I give flu shots every year. I test people for TB. You know, people don't access health care because the addiction is the most important thing to people. Hey, Leah. I was looking for Leah.
Not here.
Oh, I'm Jeff. I'm the nurse with public health.
My name is Dawn, and I've lived here for about 3 months now. We got hand sanitizers and we got dish soap and stuff like that so we can keep our dishes clean. And it's like I just had 2 really bad ear infections last week, and hopefully they're going away. I haven't been to the doctor yet because I just got medical not too long ago, so I'm able to go see a doctor now.
I'm a nurse with public health and the REACH project.
He gave me his card and he said he's going to help me to find a primary care physician. I've seen that they come down and help out a lot of people down here with, you know, with abscesses or colds or coughs, or yeah, they do real well.
I can help you with that. Yeah.
He's compassionate, caring,
How about your other one? Not so bad.
patient, and he listens to your problems, your health problems. And,
Okay.
all right.
Okay.
Help me up.
Okay.
I love him. My friend.
Oh, you're welcome.
I think there are a couple of reasons that the homeless population is more vulnerable to communicable diseases. One is that they have less access to hygiene services, whether that be in terms of laundering their clothes, in terms of showering themselves. If they get dirty or exposed to something, they don't necessarily have the ability that same day or even the next day to get clean. I think the other reason is that folks who are living homeless often have underlying medical conditions, which makes them a little bit more vulnerable in terms of their immunity.
To improve their lives. We do that by addressing their spiritual, physical, and emotional needs. The food, the showers, the laundry, the health care, all to encourage the health and the well-being of all of our members. We believe in not only having a place that's clean and healthy, but also modeling that. The Native American population is more vulnerable to a lot of communicable disease. For one, our population has higher instances of cancer, of heart disease, of diabetes, asthma, chronic arthritis, and just a number of ills.
Shelters are really key in terms of the folks who are living homeless, both as sort of the gatekeepers or the sort of sentries to recognize illness, both when it first comes in the door if people are sick, as well as when it first breaks out in the shelter. So if shelters are using screening questions about have you had a cough, have you had a fever, or weight loss, simple questions that can help identify people who might be infectious when they come in, that's sort of a good start and entry into identifying people who are ill.
Intake is the first step to identifying potentially infectious conditions. It is not necessary to ask about specific diseases, but rather to gently inquire about typically encountered symptoms.
The intake process is thorough. It takes about 2 hours often.
How are you feeling right now?
Some helpful intake questions might be, how do you feel? Any fever? Any weight loss? Have you been coughing? Do you have a sore throat? Runny nose, swollen glands? Have you had any skin irritation, rashes, bites, sores or wounds, abscesses or ulcers anywhere in your body? Any digestive problems, nausea, vomiting, or diarrhea? If the client answers yes, provide referral for care and supply items to prevent the spread of germs, such as facial tissue and hand sanitizer. Provide convenient disposal of tissue waste and easy bathroom access. And during their stay, ask clients to report any new symptoms or health complaints to enhance early intervention. Clearly, homelessness puts people at risk for poor health and communicable diseases. Agencies play a key role by educating staff implementing health and safety policies, and providing environments that discourage the spread of communicable diseases. Staff in these agencies can serve as the first line of defense by identifying clues to illness and making appropriate referrals.
My life changed around when I became homeless, but these places helped me to have somewhere to go, to clean myself up.
We're eye to eye. We treat them with respect, and they like that. And they feel good about coming here. They feel like walking in at home.
Snug is a bug in a rug without the bugs.
Well, I just try to eat right and get as much rest as I can when I can.
You know, out there on the streets is kind of hard.
We're incredible survivors.
Wash your hands all the time, as much as I can, hand sanitizer a lot.
For me, I just like to act like everyone's contagious. So it just keeps you extra safe.
La higiene es muy importante, hay que lavarse las manos.
That's real important for them to clean their hands.
손을 씻으면 건강해집니다.
Wash your hands, wash your feet, wash your face.
Yeah, wash your hands, stay healthy. I wash my hands a lot.
勤洗手，保健康。
Wash your hands and stay healthy.
Just keep your hands clean. Go and see a doctor if you can go see one. If not, find some programs like these guys do and just do what you can do to stay healthy.
And I appreciate y'all coming look for us to make sure that we're all right.
Not everybody can go through what we go through and make it.
But with your help, people living homeless can reduce their risks for communicable diseases.